Thanks so much. You can hear me, yeah? I mean, I probably don't even need a microphone. I'm super loud anyway on my own. But anyway, I am Deb Hall, and I have with me today Savannah Newman, who is a TRT in the Neighborhood House and also a CNA. And I'm going to talk a little bit about the things that Savannah brings to the table with our organization. So first of all, let's start out talking about what is a caregiver. Caregiver is a very broad term for any person who provides service or provides assistance for another person who cannot live independently due to developmental, physical, emotional, or psychological needs. So today we're talking about people who have cognitive impairment, and that is a huge portion in our population, as we know. A caregiver is also anyone who helps chronically ill patients cope with the illness. Caregivers can be in-home healthcare workers, they can be family members, or they could be a friend. So let's talk about some of the stages of caregiving, the caregiving experience. We start realizing at some point that someone that we love needs care, and we know that that journey is probably coming toward us, and we start preparing for that. We then begin our roles as caregivers, and that maybe we're stumbling through that. Sometimes it feels like we're stumbling through that because it's difficult. Caregiving is very difficult, and we learn as we go. And as Alzheimer's or dementia, another dementia kind of progresses, we might have to change the things that we're doing as caregivers because the disease process is changing constantly. And so we have to adapt. We have to learn and we have to adapt. All of a sudden we realize we are fully immersed. We are a caregiver and we are deep in the caregiving process. And we start realizing, this is my life. This is my life right now. And then we realize we are still caregiving. And oftentimes when we realize that it's gone on for a while, we start thinking about, we need some help. We start looking at that. And I think Dr. Supiano articulated it quite well when she talked about it's okay to need help. It's okay to ask for help. And it's okay to think that you're the only one that can do it the way that you do it, because you are the only one that can do it the way that you do it. I am a caregiver for my parents. They're 83 years old. Neither has cognitive decline, but my mom loves things done the way my mom does things. And so often she says things like, can I show you how to fold those socks? I don't know if that's the end of the world, but I say, sure, show me how to fold those socks. So sometimes we need help, and we need that help because it is so intense to be a caregiver. So we start seeking out help. Hopefully we start seeking out help. At some point, the caregiving experience ends. The caregiving experience, as we know, ends. Sometimes that is with the passing of the person we're giving care to, or sometimes it's because that person requires placement in a long-term care facility. And that's okay. That's totally fine. But often we wonder what comes next. Because we are so immersed in our caregiving experience, we often say, oh, I don't know what to do with myself now. I've given up my friends, I've given up my passions, I've given up these things, and I don't know what to do next because it has become so full-time. You got all this time on your hands and you're wondering what to do. So that's where we come in. I think these pictures are just kind of representative of the caregiving experience. Sometimes it's so great and it's so happy and everything goes right on schedule and you fold the socks right or stack the dishes correctly and things are good. And sometimes you feel a little bit like this plant and you just feel wilted and you're like, oh, I'm so tired, I'm so exhausted. I just need to get through this day. And both of those feelings, you're going to have them. You are always going to have both of those feelings at one time or another, and those are okay. So we're going to talk a little bit about Neighborhood House, and this is our beginning. This is our founder, Emma J. McVicker. And Emma was a suffragist, an educator, a founder of Free Kindergarten Association in 1894, which became the Neighborhood House in 1911. She was also the superintendent of schools, the state superintendent. So she's quite a woman. And when Neighborhood House first started, well, and let me mention this, This is our 130th anniversary this year. We have been around for 130 years, which is 2 years before Utah even became a state. And so that started as childcare. And then about 50 years ago, with the help of our wonderful board that we had at that time, about 50 years ago, we started the adult day services. And there was nothing like it in all the land. It was really ahead of its time. And so we care for any adult, and I'm going to speak specifically to the adult side. We do have childcare. We have hundreds of kids involved in our childcare, and it's a different part of our campus. But I am going to speak directly to the ADS side, the adult daycare side. So we care for anybody 18 or over who needs supported care during the day. So about 70 or 80% of our clients, and that number varies from time to time, are people that are living with dementia, and the other 20 to 30% are people that are living with some kind of disability. So those disabilities may include someone living, someone that is on the autism spectrum, someone that has Down syndrome, so just many, many forms of disability. So we care for all of those people. Right now, we have had kind of an influx of younger clients, which we love because it helps us interact with it helps them interact with our older clients. And a lot of times, someone who's been a young adult, they age out of their sort of school program by the time they're about 22. But they still are not able to be on their own. So we love to have those clients come and visit with us and stay with us at Neighborhood House. So that's who we care for. Our model is a social model. We are not a medical model. So we are not rehabilitative in any way. We know that no one is going to be rehabilitated from dementia or any other of the disabilities that we serve. So we are a social model. And we have our programming is designed specifically to meet goals, and we'll talk about that a little bit later in a little more depth, but we design our programming around goals to make people successful in our program. We want people to go there and feel like they are accepted, feel like they have friends, feel like they can do it, they can do whatever, and we do that through various activities. You might say, that must be a cajillion dollars. It is not. We operate on a sliding scale fee. We are a nonprofit, so we are privately funded. While we don't get reimbursement from Medicare or Medicaid or DSPD or the Veterans Association, we do have people pay for their own care, or the families pay for the care. However, it's sliding scale. So for instance, our sliding scale starts, if somebody is making $400 or less a month, the cost of that is $11.50 a day. If they are making $5,000 a month or more, the cost of that service is $75 a day. However, and then, all ranges in between. That being said, even if someone's making $5,000 a month, we have a hardship program. So if families still can't afford it, we have a hardship program that will cover that cost. And included in that cost is not only the programming, continuous programming throughout the day, it also includes two meals and a snack. So the cost is fairly low, and our actual cost of providing that service is about $140 a day. So wherever you fall on that scale, it's much, much less. Even at the top, it's about half of what it costs to provide that. So how do you get started? Well, I'll tell you. Savannah is at our table. We have a table out in the conference room, and we have intake packets. To get started, we do require that families come with the person that's going to be attending and take a tour of our facility. It is a breathtaking, spectacular facility. It's on a 5.5-acre campus. It's a new build, and our rooms kind of go in a circular, they kind of go circular so that every room is available to every client, and they can move about freely. We have a pretty intense intake packet. but that's because we want to provide person-centered care to the people that are going to be attending our facility. And to do that, we have to know social history, medical history. There's a part in there that we ask doctors to fill out. We want to know about dietary restrictions so that we can meet all of these things that need to happen for somebody to be successful. We are licensed through the Department of Health and Human Services, so that being said, we have a lot of rules that go with that, and we love that because it helps us manage that business to the very best it can possibly be. One of the things that I love about our service is that most places a ratio is not imposed, like client or patient or resident ratio as compared to number of staff. We do have that because that's set up for us through the Department of Health and Human Services in our guidelines. So we have a very small ratio, 1 staff person to only 6 clients. So we allow for that even when somebody's taking someone to the restroom or they're helping somebody maybe that's not feeling well. We allow for that, so we overstaff so that we're always maintaining that ratio because that licensing is so important to us, so we stay right within that. So that's kind of our cost and how you get started. We will also do an interview with you, not a formal interview, but when you come with your family member, we'll sit down with you or talk with you about any concerns, so that you feel really good about this decision to take your loved one there. So you might say, how do we care for your loved one? And there is, again, I mentioned goal setting. We have 4 pillars that hold up our organization. They're physical, cognitive, emotional, and social. So every client meets 2 goals every single day. And as we watch that client in their disease process, they might decline some. And so we redo their goals, and we do care consultations to make sure that everybody has access to goals that they can meet so they're feeling successful. And we ensure that every single person meets those goals because we do care consultations. So I'm saying a lot of things that we do in a medical setting, even though we are a social setting, but I like to think of it as kind of healthcare-ish. And so we take vitals during the day, and we watch for people. We can pass meds. Savannah is a CNA, and we have a couple of other CNAs, but Savannah acts as does our med pass. We don't, of course, we're not medical, so we don't have an RN on staff, so we can't push insulin, and we don't pass narcotics. But that doesn't count anybody from being, they are not left out. If they can self-administer insulin or something like that, then that's also fine. So we have somebody that monitors every single month. They go through care plans, and they see if those care plans are still working, and they adjust the goals if need be. The meals that I said we have 2 meals and a snack, they're fully nutritional because we follow the CACFP guidelines, which are the school lunch guidelines. In school lunch, you have to be fully nutritional meals. So we follow that CACFP guideline because we get reimbursed for those meals. The staff specialties that we have Savannah, who's our only TRT, which means she's a therapeutic recreational technician, TRT. And we also have a rec therapist on board because we're recreational therapy, so we have a CTRS on staff. She and Savannah design all of our programming to ensure that each client is making their goals and that they're having a successful experience. We also have a gerontologist on staff. In fact, she graduates with her master's in gerontology tomorrow, and so we have her on staff. And then we have lots of other levels of CNAs and different specialties. And Savannah actually is our longest standing employee, and she's been here for 5 years taking care of our clients. The activities that we have, somebody might say, wait a minute, you have a giant skee ball, an inflatable skee ball set up. And yes, we do. And they'll say, how does that ever meet a goal? Well, it meets a goal because it's a physical activity. It's also a social activity because people are cheering people on. But also, as they're playing skee ball, they get a 10 or they get a 50, and somebody will invariably keep track of that and say, you're now at 30. Oh, you're at 70. Oh, that was another 50. So they're adding, and that's cognitive. They're keeping their brains active. So even something as simple and as fun as skee ball can be turned into something that might meet 3 or 4, all 4 goals. So our activities are varied. We also do so much science, around music and memory. So we have people that will come in and provide music therapy for us. We'll pull out, they call them rhythm sticks, so drumsticks or bells or percussion or something like that. So we do a lot of music. We have somebody that does yoga and Tai Chi. Those help for fall prevention. Anybody that's doing Tai Chi and working on balance, it's helping with fall prevention. We also, because we do have an amazing children's side, and our children's side starts at 15 months and goes all the way up to approximately teenager, and then we have a teen program in the summer. But we do so much intergenerational work. We have 2 formal activities every single week, and we have a program called Grand Friends. And what Grand Friends does is it helps normalize that aging process for children. So it's not unusual to see somebody on a walker, somebody with a cane, somebody in a wheelchair, or somebody that maybe asks the same question over and over and over. It's just normalizing that. And this is my favorite because it just happened, but I had the intergenerational class coming by my office, and I stepped out because my niece goes there, and I said, "Hi, Ray Ray." She said, "Hi," and this little boy said, "Is that your friend?" And she said, "That's my aunt." And he goes, "Are you one of our grand friends?" And I'm like, well, I mean, not officially, but I'm old enough to be your grand friend. But I love that. And I went out and sat in the garden with him, and we had a really good time. So I'm now a grand friend. Every single day, the activities that we have between 10 and 12 activities every single day. So that's pretty impressive, and people get to choose where they want to spend their time. We are a home away from home. It is a very home-like environment. While we, of course, have designated spaces, everything is welcoming. So we have an arts and crafts room. It looks out on our garden. We have a gigantic garden and a greenhouse. It's a sensory garden. Lots of intergenerational things happen in our garden. We have a whole children's gardening space. They already have lettuce growing. It's beautiful. And we provide loving, nurturing, wonderful care. I have managed many staffs in my life, and I say this to our staff all the time. I've never seen a staff like this, ever. And they are always looking for further education and how do we take care of the people that we're serving. So we bring in specialists. We brought somebody in last month from he's the traumatic brain coordinator for the state of Utah, so he came in and gave a presentation on TBI. And in a couple of weeks, we have somebody from the Epilepsy Foundation coming because we have somebody that just started that has seizures on a very regular basis, and we want to make sure that we're providing the appropriate and educated care that we need to for that client. So our care is really, it's just extraordinary. I want to give you some of the statistics so that you can see what I'm talking about, because it sounds great if I just have a bunch of words, but I want to show you numbers. And these numbers come from just January to April 30th, yesterday, 2 days ago, for our statistics for our program. We have had a total of 978 activities during that time. We have taken transportation trips, 2,039 transportation trips. And transportation means we also have a bus service, so we offer door-to-door for our clients in 3 specific routes. And part of our licensing says our clients cannot be in our van longer than 1 hour. So we are very specific in our routes. But we do have a lot of people who also arrive by paratransit, and it's the same price that is built into our cost. UTA charges the same. It's $4.50 each way. But tons of people come on paratransit. Our transportation trips also include going to community outings. So last month we went to the Capitol to see the blooms, and I think right now they're at the Peace Gardens or just got back from the International Peace Gardens. We go to the Museum of Fine Arts. We go to the public library. We do a lot of community activities. So transportation trips are included in that. We have a dedicated staff of drivers. We have a driver for each van that we have. We have 3 vans currently, and we're getting, I think, 2 more this year. So we also ask our drivers to go with us so they can help, transport wheelchairs. Sometimes we have so many people that are in wheelchairs that we have to have a bus that's dedicated just to transporting those wheelchairs. So it's really nice that we have this driving staff that will help us, because we don't ever want to see these trips. We don't want to ever see numbers go down. Community outings in just this, on top of the 978, we've had 12 community outings in those months, so approximately 3 a month. And fall prevention classes, 52 fall prevention classes, 0 falls. I mean, we have had falls in our history. We've had 0 falls this year, and I think we only had 1 fall last year. And the meals and snacks that have been provided, 7,968 meals that we have provided this year, just this year alone. To give that a little bit of context, Jamie, who is the one that's graduating as a gerontologist tomorrow, and I went to a national daycare conference last year in Chicago, and we were invited to be to do the poster session, and we had some of these same statistics, and the meals for 2022 were a little over 20,000. This year, this is our growth. We've already served almost 8,000 meals just in 4 months. So it's growing all the time. And Neighborhood House as a whole provides about 100,000 meals a year. So we get reimbursed for that through the CACFP program. And so we're really proud of our food program. So let's talk a little bit about caregivers. I got to talk faster. Caregiver respite, we are big on caregiver respite. It's why our program exists. It's a great place for your loved one, but you need a break. You need a break, and that's what we're here to do. It reduces caregiver stress. It reduces caregiver burnout. It may extend placement into long-term care facility, and it gives time back to the caregiver. We don't care what you do with that time. You don't have to do anything fancy. You can lay on the couch and watch Lifetime murder shows. That's fine. We just want you to have a break, and that is what it's designed for. We are actually working right now with the School of Social Work at the University of Utah, and we're designing a very comprehensive caregiver plan so that we can do things with our clients and their person. So maybe it's hard to take somebody to the movies. It's hard to take somebody out to dinner when you're dealing with a dementia diagnosis. So we want to do things like create maybe a little French bistro, and we'll be the servers and we'll provide dinner so people can go, let's have date night. Or maybe we provide a caregiver spa day, and we just invite caregivers to come to that. So we're working on that currently. That's a really big goal of ours, because providing caregiver respite is mandatory. It is mandatory, and nobody talks about it enough, except for people like us who do it and who work in it and who are doing it all the time. So this is just some of our clients. I love this one especially. It was the National Senior Fitness Day, and this is Asusena, who is one of our employees, and she dressed up as Richard Simmons, and she wore that outfit all day long. I don't know why not. Fabulous. And anyway, so just a few of our clients and a few of our things. If you'd like to stop by our booth, we would love that. I do have some intake packets for people, and you can come take a tour of our facility. We're right in Poplar Grove. We're at 1050 West, 500 South, smack dab in the middle of Poplar Grove, right in the neighborhood. And the fanciest thing about us is that in that neighborhood, there are peacocks everywhere. So we have about 18 peacocks, and when I come to work every day, there's lined up at the door, and I'm like, where do I work? I don't know where I work. And yesterday, when I came, there was a bunny hopping through the garden. So I got these peacocks, and it's mating season, so Bob had his tail out, and there's a bunny hopping by, and I'm like, I am Snow White. It's so great here. It's so great. Anyway, come and take a tour with us. We'd love to show you around. Bring your loved one, and I think that's my last slide. Okay, thank you so much.